Morning, everyone. Dr. Eric, the fitness physician, and I'm going to be talking about testosterone, hormone therapy, and the risk and relationship to cardiovascular disease, blood clots, and much more. A little mini series on a mini series, right? I'm going to do some myth busting. I alluded to this in a few social media posts a few weeks ago about how we don't have to worry about blood donations and blood getting thick on testosterone. I'm going to bust that myth again and talk about it some more. So everyone, hopefully, have had a great weekend and looking forward to doing some more talk. So again. Testosterone in blood, right? We're going to talk about the blood, cardiovascular disease, what we call, worry about elevations in hemoglobin, hematocrit, the blood counts. We're going to talk about all those things. So today, going to do a good start at the beginning and do some basic reviews. There's multiple meta-analyses, meaning collections of studies. It's not just one study or two studies, but it's a collection of studies. So it's many studies. And I will spare you all the methodologic data and information, but the bottom line was that yes, there was elevations in hematocrit, the red blood cell count, how many red blood cells are floating in the bloodstream, and a lot of them were well over 50%. But there was no adverse cardiovascular events. This means stroke, heart attack, basically blood clots, what we call in the legs are called, just called a DVT, or blood clot in the lung called pulmonary embolus, cardiovascular disease, like I said, strokes, or other cardiovascular diseases, or endpoints such as death or anything that you consider bad, right? Any cardiovascular bad outcome, heart attack, stroke, death, clot, etc. So basically, no increase. Now there was an erythrocytosis, but this is not polycythemia vera. And I've talked about this many times. Still, I hear this talk of this thick blood is polycythemia, and you got to donate blood, blah blah blah. It's not the same thing. So polycythemia is an elevation. You get all the blood cell counts go up, the platelets, the white blood cells, the red blood cells. It's a genetic disorder. It's almost, I want to say it's not an autoimmune condition, but it's more of a genetic disorder. But in the same vein as autoimmune, it's a very unique formulation. It's basically something you can't change. Again, it's genetic, right? And there's specific treatments for that, and it's not that common. However, erythrocytosis is an elevation in the red blood cell counts, and this has no risk, basically. It doesn't do anything, doesn't cause any problems. And especially in these studies here, no risk of any of these adverse events. Another study called the Copenhagen City Heart Study. There's almost 5,000 men, longer-term study. Again, no increased risk of any of these bad outcomes. Again, there's hundreds of studies showing, we still hear to this day that, when you go to traditional medicine or you go somewhere and like, you're on testosterone, you're gonna have a heart attack, you're gonna have a stroke, you're gonna have thick blood. And still hear that to this day after thousands and thousands of studies. So it's crazy. But another meta-analysis, again, of course, we all know how testosterone therapy for men and for women can increase quality of life, libido, and so much more, reduce the risk of so many bad outcomes because it's a metabolic treatment, right? It reduces inflammation, does all these beneficial things for the body and the health, and I've talked about this many times, and I will talk about it some more because that's what I do. And again, no risk, no increased risk, cardiovascular disease, DVT. And interestingly, this one even talk about prostate cancer, no increased risk of prostate cancer, and actually, there's a decreased risk in prostate cancer in this study. Again, over 5,000 men. So again, yet another myth about prostate cancer. Actually, men with lower testosterone have higher incidence, and when they get cancer, it tends to be more aggressive and worse, more badness, right? So again, the higher the levels, the better it's going to be for prostate cancer too. So I thought that was an interesting thing that they also studied. So anyway, hope you like this. So tune in for more. I'm going to be talking more about this week and next week, and talk about all things related to hormonal fitness, muscle medicine, health and performance optimization. That is what I do, doing cutting edge protocols unique to the field in general. So please tune in if you're interested. Please like and share this post, and let me know if you want to hear more. If you have any other questions, if you have anything else specifically you want to learn about testosterone for men and for women, please DM testosterone below, and I will reach out to you and answer any questions. Everyone have a rocking week, and we'll talk to you soon.